Hi, hi, hi. Please excuse my appearance. I had the craziest day today, and I am here now, Instagram Live. And today we will be talking about exosomes. I'm really excited. I know I've talked about them before, but here I am talking about them again. And I'm gonna have a special guest on today. His name is Dr. William Gale, and he is based out of Manhattan, New York, and he is an expert in exosomes. So we are going to be talking about what are exosomes, what do they do, who needs them, and where you can get them, how do you decide which ones to get, topical versus IV, FDA considerations of exosomes. So I'm sure a lot of you have heard about exosomes, but you might not know what they are. They're definitely newer. The concept and the science is newer. We're learning more and more about them every single day. So I'm really excited that Dr. Gale agreed to come and do this live with me so that we could really dive in for the next 15-20 minutes and really get the most information we can on what exosomes are. If you guys have any questions, feel free to leave them at the bottom right here or DM us later. All right, without further ado, I'm gonna let him into the chat. Where is he? He's right there. I see him. Add as moderator. I think that's... It's 10 p.m. there, so he kindly stayed awake just so he can get on this live with me. And believe me, I'm in bed by 9 p.m.
Hi.
Hello. How
Hi.
are you?
Let's.
Good.
I'm good. I'm good. It's kind of late here, but it's not that late for me. Hold on, I'm trying to just.
Well, isn't it true that New Yorkers stay awake late? They're like mostly night
Oh,
owls.
I do. So this is pretty good for me.
Okay,
So
good.
this is fine. I'm just trying to adjust this. Okay, so
Oh
you can see
no,
me. Okay.
now you're crooked.
Now I'm crooked.
Yeah, the other way was you were. Yeah, there you go. That's good. Perfect.
Okay. We're
All
good.
right, awesome. Thanks for joining me.
Sure.
I really do
Sure.
appreciate it.
Okay.
So today, I wanted to talk to everybody about exosomes because I think it's a trending topic. A lot of people are interested. And I know that you are an expert of exosomes.
Yeah.
You provide them in your clinic and you have your own exosomes that you share with your patients. So I would love it if we could just, start with the
Okay.
basics. When a
You ready?
patient asks you what are exosomes, how do you break it down for them?
Normally, what I say is I have to backtrack a little bit and go to the stem cell because one of the things I always say when I lecture on this is that an exosome can only be as good as the stem cell it came from. Usually, I think just about everyone says that. Anyone who steps in front of a group of people and talks about exosomes has to say, if you have a good stem cell, you should have a good exosome. So what I like to talk about is a little bit more than the basics, and we'll get into that soon. But let's make sure everyone knows the basics because sometimes I just assume people know and they don't know. So we'll go the basics, okay? So a stem cell, we pretty much all know, has the ability to regenerate areas of damage in our bodies,
Right.
okay? And our purposes, we're always looking for aesthetic reasons like skin, especially face, neck, and that
Yes.
kind of stuff. So that means what kind of stem cell do we want? Well, we want a mesenchymal stem cell. The initials are MSC.
Yes.
And most people, I'm sure, listening to us know that already. And why do I say MSC? Because the other one is called hematopoietic stem cell. And hematopoietic stem cells, which are very abundant in the bone marrow and umbilical cord blood, well, they form really good red blood cells, white blood cells, platelets, and those are great if you have something like multiple myeloma, leukemia, lymphoma. But if you, in our purposes, if we're looking to have better skin, and sometimes in my purposes, I'm even looking to regenerate organs like heart and lungs, and I do all sorts of things with exosomes,
Okay.
joints, tendons, right, rotator cuff tears. But when we're talking about skin, we want the mesenchymal stem cell. So where is the best mesenchymal stem cell? In my opinion, and most people's opinion, since fetal cells are illegal, fetal stem cells are illegal for very good reason. Why? If that fetus was going to get lung cancer and you get those stem cells, you're going to get lung cancer. But the next best thing to regenerate that you don't have to worry about catching anything bad is an umbilical stem cell. So my favorite is umbilical cord tissue and or Wharton's jelly. Wharton's jelly is
Jelly.
a protective jelly inside the umbilical cord that's just chock full of mesenchymal stem cells that are just they just can't wait to go. They just can't wait to regenerate some bad tissue. And remember, let's remember this. They want to make things new. They don't want to just repair. They want to make them brand new.
Yeah.
So now we know we like Wharton's jelly. We like umbilical cord tissue. Do we like amniotic fluid? Not really. There's a reason. Should I tell why?
Sure.
Okay. Environment. Everything in this world is a product of genetics and environment. The environment of amniotic stem cells has been amniotic fluid, which is, for the most part, baby urine. So they've been sitting around in baby urine for a long time, so I would prefer not to use those. And now, what's one of the other things that stem cells come from? They come from adipose tissue or fat. And that's pretty good. But, you know, most of that fat is coming from someone who's about 20 to 30 years old. That's where the fat usually comes from. Now, I would like to get something a little younger. I mean, 20, 30 is good. But if I get something that really is about 20 years younger than that I know has more potential for regenerative purposes, I'm going to take the youngest I can get. And that now we're back to umbilical. They're easy to control. You don't have to worry about catching anything bad, like I said with fetal. And you don't have to worry about the moral argument with fetal stem cells, which are women who may get pregnant to have an abortion to sell the fetal tissue. That was the big moral argument with fetal stem cells as well. You don't have to worry about that with umbilical cords, because what we're doing is we want a healthy mommy to deliver a healthy baby, and then we hope that they will donate that umbilical cord. And we test for every disease you can possibly think of, mommy, baby, and cord. And if everything checks out, we'll take that cord. So now we talked about my favorite, which is Wharton's jelly and umbilical cord tissue. So we can take that mesenchymal stem cell, and now we put that mesenchymal stem cell, here's the next important part. We put it in fluid. I call it the stem cell food. It's usually a beaker or a glass like incubation tray. But this is so important, the fluid, which is called cell medium, is crucial, because that's what's going to make your stem cells strong. Now, so when I tell people, how do you know you're going to get the best exosome? How can you tell this one company to that company? Well, the way to do it is to know, where did the stem cell come from? For one, we want a mesenchymal stem cell, in my opinion, from umbilical cord tissue, Wharton's jelly. Number two, what or who was the lab, who's the PhD in that lab that actually took that stem cell and actually got the exosome from that stem cell? Because that is crucial. When it comes to cell medium or media, the person who has actually made the cell media guards it like you can't believe. Like, these labs have people who've been working on this for over 20 years. And they tweak it in just the right way, because the cell media is not just a mixture of water. Let me just back up. We used to use serum. We used to use a bovine serum or fetal bovine serum to grow our stem cells in. Now, let's also recall stem cells secrete exosomes into that serum. And it turns out when you use an animal serum like bovine serum, you can actually have a reaction to that. So the cell media that's used now to grow our stem cells, that those stem cells then secrete the exosome into that fluid, well, that has to be worked on by adding a lot of nutrients like vitamins and growth factors and a certain amount of sugar or glucose for energy. Not too much, not too little. Buffers for make sure the pH is neutral all the time. And these people who have worked on this, some have taken over 20 years to perfect their cell media. It's the secret sauce that people don't talk about. For example, I know some exosomes that are produced from stem cells in a certain cell media that don't have to be kept frozen. They're stable at room temperature. And if I ask that PhD who made that cell media that he says that's the secret sauce, he won't tell me. He just says, I've taken steps to ensure this, but I'm not going to tell you what makes my formula so valuable. So they guard this. This is a big secret. But once you know where the stem cell came from, and once you trust the lab that has really good cell media, which is the stem cell food, the better the food, the stronger the stem cell, the better the exosome. So what's happening now? Stem cells are getting stronger in their stem cell food or cell media, and at about 48 to 72 hours, they secrete the stem cell into the media. And that first, let's say born, almost firstborn, is the first generation. That's the first generation exosome. They're the best, okay? Rahi, I don't know what generation you are, but let's say you're the first kid born, you're the best. I hate to
Thank you.
say if you have brothers and sisters.
I am
If
the
you have a
eldest.
brother or sister, you're the
Yeah.
oldest and you're the best. I'm
Thank
the
you.
oldest too. The second generation is not as good as the first.
Thank
The
you.
third generation is not as good as the second. So here's a really interesting thing that happens. After about 6 or 7 generations, senescence starts to set in to our stem cells. And when you have senescent cells, and for the people who are listening who don't know what senescence is, because it's really important, it's now cells are dying. And when cells die, they produce a lot of inflammation. And they don't secrete any exosomes that are good when the cell is starting to senesce.
Yeah.
And there are labs out there that will go hundreds of generations of growth. And after about 7, 8, or 9 generations, the exosomes are just worthless. And that's because the stem cells aren't good anymore. So one of the labs that I work with, we only go out, we say 1 generation, because we like to take that fluid that the stem cells are growing in. That's the stem cell food. The stem cells are using that fluid for energy to get really strong. That's the cell media. You're starting to see the fluid disappear as they are using it and as their food, and now they secrete the exosome into that fluid. We like to collect that fluid at 48 to 72 hours. Then we filter the fluid, and remember, exosomes are 1,000 times smaller than the stem cell they came from. So they're measured in nanometers. I know I'm kind of going fast here. But when
Yeah.
you filter and filter and filter that fluid, you will be left only with the exosome. And if you collect that fluid at 48 to 72 hours, you're going to have first generation, maybe a couple of second generations snuck in there. And so um, let's see what else I can say. For also the people out there, if you think of the stem cell, I like to think of the stem cell as the queen bee, and I like to think of the exosome as the worker bee. And that's the way it is. The stem cell makes the exosome, it secretes it into that fluid, and it does all the work of the stem cell. That's how stem cells actually do their work of regenerating skin or tissue. They make exosomes to actually go and do the work. So I like to think of the queen bee making the worker bee and sending the worker bee out of the hive to do the work. And that's basically super important. The third most important thing to know if you have a great exosome is to know uh, what I call the Carfax. And it's a report from an independent lab called the Nanosite Report or Nanotracking Analysis. And there was a recent lecture I gave where I actually showed what nanotracking reports look like. They're really easy to use, to read. And they just are basically lines on a piece of paper, and the line will go up and it'll come down. And the narrower the peak of the line, and the narrower the base where it started from, the purer the product. So if you can ask a lab for a nanosite report or nanotracking analysis, and if you see a line, I'm trying to see my finger, go up and gradually come back to baseline, that's not a good exosome. If you see a line go up,
Why?
come
Can you
straight
explain
down,
that a little bit better?
yeah, it means that there's a lot of different sized particles. It means it's not a uniform, pure product. That's what it means. We're
Okay.
looking for an exosome basically all the same size. And if we know that we see, I can probably show you examples. I have an iPad right here. I don't know if you guys can see this. Ah, hold on. Maybe tough.
I do think
Maybe.
it's going to be a little like we're getting into like a little bit more in depth for
I can't.
I think
Yeah.
what
All
I
right.
want
Well,
to talk about
it's
more is like basic stuff so everyone kind of understands the uses of exosomes, like
right.
what you what uses
Well,
can we
I was
use.
trying to tell people some stuff of how you can actually compare one company to
Yeah,
another company because it's kind of confusing right now. There's about 150 companies out there selling exosomes,
right,
and it's impossible to know who has the good one or who doesn't have a good one. So
right,
there is a way. There is a way to tell. So just know that there
right.
is. You can actually compare apples to apples. Okay, what did you want to ask?
um what are, I guess, we know exosomes are good for like skin and regeneration, but what are some of the top uses of exosomes?
The top use for our aesthetic people who are listening is to use them for much less downtime and a better result.
Yeah.
And I'm probably one of the few people over the years who have shown people that I like to actually put my exosomes on the face and neck before I do a procedure.
Okay.
And there have been people at meetings that say, well, why do you do that? And I say, if I can do something to give my client a better result with less downtime,
Yeah.
why aren't I putting them on before I even start my treatment? So I do apply topically my exosomes. Let's remember now there are 20,000 pores on the face. So those pores uh, do make it easy for the exosome to sink right into our skin. We don't have to go microneedling and make holes for them. I
Right.
mean, that's nice. It gives more inroads in, but we
Yeah.
have 20,000 pores. So I like to apply just a very light topical layer first, and then I'll do my microneedling radio frequency, a couple of passes, and I will apply them again to keep the inflammation down. And
No.
then what I'll do is I'll do my CO2 laser, and I'll apply them again and do some more laser, apply them again. And I find that my clients, instead of like 2 weeks of downtime, only have a few days of redness. It makes a gigantic difference. So exosomes are incredible for reducing inflammation, especially secondary to some of the treatments that we do in our offices.
Yeah.
And they promote not just healing, but they promote a much better result because they stimulate collagen production while inhibiting scar tissue. I mean, that's
That's
incredible. So if you want a
amazing.
better, yeah.
Stimulate
So
collagen production while inhibiting scar tissue.
yes,
That's great.
yeah.
What are some of like the more regenerative roles that exosomes play, like in the world of regenerative medicine? Like, have they been used in like
Right.
orthopedics or GI,
If if
cardiology?
if you know if we go back to the stem cell and we think about what stem cells are, you can go all the way back to the embryo. Some of those stem cells, they don't even know what they're going to be, right? They can be anything.
Yeah.
So we know stem cells have the capability to be anything.
Yeah.
So now, if we know the exosomes do the work of the stem cell, we can put exosomes into a joint, like a bad knee or a torn rotator cuff of the shoulder or an injury to your elbow. It could even be carpal tunnel. And what we can do, and let me also say this is not FDA approved,
Right.
but what's going to happen is the exosome is going to look for the damage in whatever joint you're using, whatever area you're putting it. And when it finds that damage, it's going to go into the damaged cell. The exosome, let's recall, is a vehicle for transport. Sometimes I call it an Uber car. And it's the passengers inside that exosome that are super important. That's messenger RNA and growth factors. And messenger RNA shows up to the bad cells. It could be a bad shoulder. When it gets into the damaged tendon or bone or whatever it is, like cartilage, it actually opens up and out pops messenger RNA with a message that says, here I am, here's the message to be a good cell. Now you have it. And look, I brought with me in my little Uber car exosome all these growth factors, up to 1,000 growth factors. And they do all the work. They do like the construction work and carry out those plans that messenger RNA had. So we can repair just about anything with exosomes. And that
Anything.
also, Yeah, there are studies going on right now using exosomes intravenously for people with heart and lung disease, liver, pancreas, GI, just like you
Yeah.
said, rheumatoid arthritis, lupus, so autoimmune diseases. I've actually, not in this country, made eye drops with exosomes for people with macular degeneration and use exosomes nebulized for people with pulmonary fibrosis who are on a
Mhm.
heart lung transplant list. And it keeps them off that list. So it's pretty amazing what you can do with exosomes.
Awesome.
Yeah.
So let's compare IV exosomes to IV. I know it's not FDA approved IV exosomes or IV stem cells. People are still doing it. You can go to another country, get it as well. For example, Japan, Mexico, other countries offer them.
Right.
So, and my audience and your audience can be international as well. What's the difference between an IV exosome and an IV stem cell?
Okay, so that's a great question. I'm really glad you asked that because I would have totally forgotten to talk about that. What a great question. So always I get asked, well, what is the difference between the two? And it's really fascinating because let's remember the stem cell made the exosome. But when it made the exosome, it gave it one plan. Messenger RNA has one plan, and it has all the growth factors to carry out that plan. And it can fix just about anything. So when I put them in, let's say in another country or in a study, put them in IV, they're going to go around the body and look for damage. Now, let's say they find something bad in the heart. Let's say you had a heart attack, they find some damage in the heart, they go into the heart muscle, the exosome opens up. What if that exosome didn't work? What if that one plan that exosome had with all the growth factors to carry out that plan didn't work? Well, the exosome is done. It's like a torpedo. It hits the ship or it misses the ship. If it misses the ship, it's done. If it hits its target, well, guess what? It's going to hang out for 3 months, at least 3 months fixing the problem. It's not like they hit a problem and just disappear. They work for a long time. But let's say that plan didn't work. And one of the analogies I use is think of an exosome going in your body like Tylenol for a headache. What if Tylenol didn't work? What are we going to do? Now, a stem cell can go in, same person, like Tylenol for a headache. What if Tylenol doesn't work? Stem cells can adapt. They can think. They can change. They can now say, hey, I'm going to become a Aleve. I'm going to become Furostat. I'm going to become Imitrex. So stem cells have the ability to adapt to situations and think of another way to go about a problem, where an exosome cannot, which is why, in my mind, a stem cell is still the gold standard. But let's also remember a stem cell is probably 4 or 5 times as expensive as an exosome. A stem cell is very hard to keep. They don't like getting frozen and they don't like being thawed. You're going to lose 10 to 15% of them. In fact, when I use stem cells, I think I'm one of the few people that actually sits in front of a microscope, takes a little bit, puts on a slide, puts a stain on. It's called tryptan blue, little cover slip. And I actually look under my slide to see how many living stem cells I have. And I know, okay, I have a really good batch here. Let's go. Let's use them. But they're very finicky. Exosomes, on the other hand, are not cells, right? A stem cell secreted an exosome. An exosome are little particles of protein measured in nanometers. They are not alive. They are not cells. So they're easy to store. And you don't have to worry about they're not going to be good if you freeze them. They're going to be good for months to years,
Yeah.
depending upon what temperature you freeze them. So stem cells are durable. I'm sorry, exosomes are durable, while stem cells are not. And exosomes are so much more affordable than a stem cell. So in my practice, the way I look about it is I always like to approach a problem with an exosome first. And if the exosome doesn't work, then I'll go to the stem cell
What are
because I
some
know a stem
common
cell can adapt.
problems that patients present to you with where you treat them with exosomes? What would you say like the
Well,
top three conditions are that you
uh,
treat, specifically your practice?
immune disorders
Uh-huh.
is huge. Dementia
You mean
is
like things
huge.
like, okay, like rheumatoid arthritis
Yeah,
or
rheumatoid
just like
arthritis
a weaker
especially.
immune system for
I'm going
whatever
to
reason?
say number one is a shoulder or a knee. Okay, number
Yeah.
one. Number two is going to be an immune disorder, like I have this arthritis, it's killing my
Yeah.
hands and
Yeah.
that kind of thing, and they ache, and
Yeah.
we can go systemic with that. And then I treat a lot of people with dementia, for which you may know I'm involved in an FDA study where I also treat them with another drug that I'm never
Exosomes
talking about.
for dementia.
And let's remember, exosomes are measured in nanometers. What does
Mhm.
that mean? They get through the blood-brain barrier. That's really a really
Wow.
good thing. Yeah.
I love that.
And then
Exosomes
I
for
use
dementia.
exosomes nonstop, of course, topically.
Yes.
I There's not a person that walks in my office that doesn't get some type of exosome, either uh, out of a vial that I put on their skin or out of a serum that they go home with and use every day. Yeah.
That's amazing.
Yeah.
Um, so there's different types of exosomes. The ones from the Wharton's jelly, from fat
Well,
tissue. What are like all the types of exosomes that are
the-
available right now?
okay, so that would be really the different types of stem cells that come from Wharton's jelly. There's umbilical cord tissue, there's umbilical cord blood, there's amniotic fluid, there's bone marrow, and there's adipose tissue fat. That's six. And of course, there's fetal illegal. We don't like that. And I already
Yeah,
said, and all of those stem cells, no matter where they come from, are going to secrete exosomes, okay? They also secrete other stuff like hyaluronic acid, peptides, extracellular matrix. So we call an exosome as a secretome, but it's my favorite secretome. So, and that's because the stem cell does secrete that. But in my opinion, after 15 years of doing this, the best stem cell is a mesenchymal stem cell from umbilical cord tissue, because tissue wants to regenerate skin, uh, tendons, joints, tissue and organs, or Wharton's jelly. I love Wharton's jelly. Yeah.
we have a question, but I want to rephrase it. What are your thoughts of what are like the side effects of exosomes, and could it potentially lead to could it potentially be a carcinogen? And would you avoid them in any type of cancer?
Okay, great question. It's kind of like a two-part question if I get it right.
Mhm.
I am not worried about exosomes causing cancer. Okay, there is no material in the exosomes that we use, because let's remember, the exosomes we are using come from great stem cells. They're not coming from a tissue, or let's say a cell in your body that contain cancer. Yes, whoever asked that question knows that exosomes are a way from cancer to spread from cell to cell. But that is a cell that had cancer already, that got cancer tissue into the exosome, and the exosome, we know, are able to go from cells to cells. It's one way cancer can metastasize. It's a way that cancer can spread from a cell to a neighboring cell. But those are not the exosomes that we use. We're using exosomes from really good stem cells. We don't have to worry about giving someone cancer with our exosomes. Now, the next part of that question, I will not use exosomes with anyone that has any kind of active cancer. And why is that? Because one of the best things that exosomes do is increase vasculature, increase blood flow in certain areas, and they promote new blood vessels to grow. Because the better your blood flow, usually the better you're able to reduce inflammation, the better you're able to heal something. But the last thing we ever want to do with someone who has cancer is increase blood flow, because the tumor's already got great blood flow. And now you're going to increase that blood flow, you're going to get a worsening tumor. So I will never do that. But I will use exosomes in someone who needs rescue therapy. So someone that had cancer, that doesn't have active cancer, who maybe got chemo and radiation, who needs basically to just get better fast, is called rescue therapy. Exosomes are fantastic for that, and so are stem cells. But I go with exosomes first. So I'll see someone who got chemo, who really knocked them out for whatever kind of colon cancer, could be multiple myeloma, just knock them out. They look like a living skeleton. We give them intravenous exosomes or even IV stem cells, and it rescues them. In 2 days, they have their color back, their hair's growing, they have their appetite. They look like a different person. It's really amazing how well rescue therapy can work. But that's not with active cancer. Okay?
Okay, any type of active cancer.
No, you're right. Any kind of active cancer. Now, there is research going on where there are anti-cancer type drugs and immunotherapy that are being put into exosomes that are then being put into the body. But uh, that's that is being studied right now. But those aren't the exosomes that we're using. Remember, we're using exosomes from mesenchymal stem cells, and all they're going to do is just reduce healing and regenerate damaged tissue.
All right, we
Okay.
have two questions. What about a pregnant woman? Can she use exosomes?
Wow, great question. I I wouldn't do it just because I don't give pregnant women anything. Uh, I will never. Let's say there's not anything. There's certain antibiotics and there's certain things for painkiller and anti-nausea you can give a pregnant woman, but I wouldn't give them anything that was still you're not 100% about. So I don't know why an exosome would hurt someone who's pregnant, but I wouldn't do it.
Okay,
I wouldn't
that's
even do
fair.
it topically. Yeah, I wouldn't even do it topically.
And what about someone with like a more superficial cancer, like basal cell?
Only after it's gone.
Okay.
Only after I take care of it. And I do that, by the way. So I show a video, and in actually a lecture I just gave, I showed a video where I removed a couple of basal cells and scar tissue from under a woman's eye, and she had it done about 2 years prior, and the basal cell came back. And I had pictures of her recovering from the first removal with actually that was a Mohs surgery where she developed scar surgery and it returned, and I have pictures of that. And then I did it myself with a laser where I removed the basal cell and removed the scar tissue, and I immediately put on my exosomes. Like I sprayed the area with exosomes first. I removed the basal cell and the scar tissue. I then sprayed the exosomes again, gave her an exosome kind of bomb to take home to use. She had 2 days of downtime, and that was it. It repaired so beautifully in 2 days that it almost looked like nothing had been done, versus when she got treated without exosomes, looked for about 2 weeks, terrible, just, weeping and blisters and scars. It was terrible. So I will put exosomes on something to repair it after the skin cancer has been removed.
And
Okay.
how does normally like what are the results?
They're phenomenal. I mean, I can send pictures. I mean, it's in one frame where I have the before and after with exosomes and without exosomes. And for anyone who wants to see that, I can send it to them because it's amazing.
Okay, they can just DM you.
Yeah, DM me and
Um,
I'll send you that picture.
Perfect. So I think we covered a lot.
Yeah, it was a
Um,
lot and a
yes,
little time.
I know. So what I think is, if anybody wants to come see you, they can reach out to you, DM you, and come see you in New York.
Right.
Um, but anything else you want to add?
I, I'm just going to say that most of the people who hear me talk already know the basics of exosomes. So
Yeah.
I like to talk about what you don't know. And so one of the important things to know is when you do your due diligence, or you know someone like me who did their due diligence, you have to trust the people who are growing the stem cells, who are getting the exosomes from the stem cells. You have to trust them. And
Yeah.
then one of the really cool things is that nano tracking analysis, because that's the only way we have to compare apples to apples. There's 150 companies out there, and who knows if they have a good product or this one has a good
Does every
product. You ask.
company offer
No,
the
they
report?
will not show you. They don't want to show you. Yeah, there's companies that will never show you
Yeah.
because they know if they had it, you'd be able to look at it and say, "Oh my God, your stuff is terrible." And then what I always tell after you, and I like to say, "Show me the Carfax," because that's what's going to show me if it's a good exosome or not. The fourth thing I always tell people: now you clinically correlate it. You have a good lab, you have a good nanosite report, and even if you don't have a nanosite report, then I will compare one company's exosome to another company's exosome. I'll do
Yeah.
the same thing. I call that the Pepsi challenge. And so when you get good results, and it was a mesenchymal stem cell, the lab it came from, you get good results, stick with that exosome. You got a
Okay.
good one there.
Two more questions, and
Sure.
then you can go and either sleep or go
No,
enjoy New York.
I'm watching the basketball game, Minnesota, Oklahoma City. I
Oh,
got it on
nice.
in the background.
Who's winning?
Right now it is Oklahoma
Okay.
City 76-65 third quarter.
Okay. So
I know
I've
you really
noticed a
cared
lot of
about that.
skincare, a lot of like K beauty skincare has exosomes in it. What are your thoughts of the efficacy of that?
It's really
Yeah.
great.
Yeah.
Uh, yeah, I can't say enough good things about exosomes and skincare. Just like everything else, when it comes to topical serums or creams or balms, it's going to go with what do you clinically think? How's it working? Uh, if you have a company that has a really great exosome and you get good results, then go ahead and use it.
Okay.
You know, I have my own,
Yes.
so I'm pretty biased about my own serum, and so, but if you have a good exosome serum, like I know I do, you'll see just bumps in the skin go away. You'll see sun damage go away. You'll see little lines and wrinkles go away. One of the things, and I'm not trying to be a commercial here, but one of the things that I didn't even know was that women just say when they use this product, their makeup lasts all day. They never have to adjust it. I did not know that was a thing,
That's
but I asked, what?
interesting.
Yeah, I said, is that good? And I said, it's beyond. That's what the girl told me,
Okay,
but I
two
didn't
more
know that.
questions. I know I said that, but I just got another question. Um, Two questions. Can exosomes help with active acne? And
Yes.
are you, if someone DMs you, can you send them clinical studies on exosomes?
Clinical studies are tough since they're not. Just remember, everybody, exosomes are not FDA approved, okay? Just remember that. So clinical studies are tough. But I can send pictures,
Okay.
like active acne. I can send you pictures of people treated with exosomes and exosome serum, combining with usually like a blue light and that are just unbelievable how well they work. Because let's also remember this, everyone. What do exosomes also hate? Besides scar tissue, besides erythema, besides bruising, they hate bacteria. They hate them. And they hate viruses and they hate fungus. But when it comes to acne, we all know the acne bacteria are living in our pores, and sometimes they love to get into those sebaceous glands. So if you have a lot of sebum, you're going to have a lot more acne bacteria. You're going to have some bad breakouts. Well, exosomes hate acne bacteria. So not only do they reduce the inflammation, as they sink through the pores and they get down to those sebaceous glands, they kill the bacteria and reduce inflammation and get rid of some of the scarring from old acne breakouts. So I love exosomes for acne.
Love that. Thank you so much.
You're
This
welcome.
was very informative. I learned a lot, and I think the audience learns a lot. I'm going to actually keep this on my profile so that people can watch it forever.
Okay.
And I really appreciate your time. Thank you so
Sure.
much.
Sure. Great seeing you
All right,
again.
nice to see you. And I'll see you soon. Have a good
Okay, you
night.
will.
All
Bye.
right,
Bye,
take care.
everybody.
Bye.